Hi there, Randy Alvarez here from the Wellness Hour. I put this short video together to discuss some of the strategies I'm going to be sharing at NASP this year, the North American Society of Periodontics. I've met most of you, especially in the core group. I've met all of you. But for the other attendees, I want to address how to succeed in the dental implant business in light of the fact that so many practices across the country, you've got general dentists that are taking weekend courses and general dentists that are highly skilled, highly qualified to place and restore dental implants. So it's become very competitive. I think I started speaking to the NASP group many years ago, and there was less dentists, there was less competition. Google wasn't, now if you Google how much are dental implants, or if you are searching for a doctor that does dental implants, the first page, the second page, and third page is covered with different people trying to get your patient's attention. So options for the public are out there everywhere. And it's probably created a lot more confusion of who to go to. So as a specialist, a periodontist, I've always said it's easier for me to promote a specialist over a general dentist. So what I want to talk about is the closing part of it. That means that, let's say you did the wellness hour or you did some type of marketing and the phone rang, the patient is going to see you for the first time. One of the challenges oral surgeons and periodontists face is that if they don't have a restorative dentist under the same roof, that case presenting becomes a little bit more challenging. The standard way that it's been done for many years, and most of you are doing it this way, is a two-step process. They visit your office, you give a complete exam, you do a CT, etc. You ask the patient to come back, or you send them to the general dentist, and then you set up a second appointment for them to come in, and you're able to give them the fees, and you're able to give them a variety of options, maybe a snap in, snap out, or a full arch of teeth that are fixed, that are permanent, that don't come in and out. So that's the standard way. So I want to give you and present to you some of the strategies on how to put your current presentations, if you're going to do it that way, in that two-step process, how to maximize that two-step process. The second way that it's being done out there is they see you, you do a complete exam, and then you send them to the general dentist, and then the restorative dentist then will present the case and go over the pricing and the fees that way. That can be a little bit scary or dangerous because now you're relying on the general dentist and their case presenter to be able to overcome the common objections, to tailor make the presentation to the patient and give them all of their options. Now the third way, which is a more modern way to do it, which I've been talking about all along, and it puts you in the driver's seat, and that is when they come in from either advertising or word of mouth or referral, when they come in, on that same day, you present not only your fees, but the fees of the restorative dentist. And so I'm going to be talking about how to design a presentation that is impossible to refuse, how to identify and overcome the common objections, and I'm going to be offering the 3 different ways. And you can choose. It'll be an a la carte menu. You can choose which one you want to adopt in your practice. One will be the where you send them out, get with the general dentist, they come back, and you present the options right there. Number 2 will be where you let your general dentist, restorative dentist present the fees. And then the third one will be you presenting the fees with having a general idea of what the fees are going to be with the restorative dentist. And it's all about a system and a strategy that is proven. And we're talking about principles of influence, weapons of influence, how to design a presentation that's impossible to refuse. I'm also going to be talking about effective follow-up campaigns, both with recall, with email marketing, and using some of the newer dental software or Infusionsoft to follow up on these people, maybe creating 52 emails that once they become a prospect or a potential client, that you are either mailing them something or you are sending them information about dental implants and about your practice and about you. the goal is to differentiate yourself. So if we do a good job with both the marketing and the overall creating a unique experience when they go to your office, they're more likely to do business with you, the specialist, over a general dentist. I look forward to seeing you in January 2018, and let's work together to make 2018 the best year ever. Our goal is to thrive in the new year, to transcend, go beyond what you're currently doing, and really come into view into the new year, and just really have your best year ever. And this isn't lip service, but everyone talks about innovation. Most of you now have CTs. Most of you, all of you are digital, right? Some of you are Lanappers. These are all innovations, but the biggest innovation that's going to have I wouldn't say the biggest, but a crucial or important distinction you have to make in 2018 is you have to update and innovate your offerings. How you talk about pricing, how you present pricing, how you present financing. We are going to cover that in my talk at the next NASP meeting. So hope you have a happy new year, and we'll see you there. Thanks.